They were just having a normal day, just like you and me.
And just like that, life for Teresa Giolito would never be the same.
My mother passed away from a ruptured brain aneurysm when she was 49 years old.
39 years later, it happened again.
My sister also passed away last year. She was 59, also of a ruptured aneurysm.
Just 1 week following the death of her sister, Teresa learned there was a screening test to determine whether she too had a brain aneurysm. And sure enough, she did.
What was that day like for you?
It was devastating. We couldn't believe this was happening to our family again. The similarities were just uncanny. So I knew that I was not going to just sit by and not act on this information that I had.
Teresa was determined to find the best of the best to save her life against a silent killer.
And I just started researching and found Dr. Mehta's name.
Dr. Tapan Mehta is an interventional neuroradiologist at Hartford Hospital. He and a highly skilled team at the Ayer Neuroscience Institute would save Teresa's life.
She had a small aneurysm in the ophthalmic artery origin.
And given her family history, she decided, I need to take care of this. I cannot let this rupture.
Absolutely. So Teresa came to me very scared, and we reassured her that the aneurysm is small. However, it does become a little bit unpredictable with such strong family history, that whether the aneurysm will rupture or not. So subsequently, we went in and placed a stent, we call flow diverting stent, across the aneurysm neck, which went really well, and she recovered well from the procedure.
And how are you today?
I'm great. I'm great. I feel so lucky. Sometimes I feel guilty, you know, I because I got the chance to live and my sister didn't.
But you're helping others through your sister.
Yes, that's what she would want.
Today, Teresa is on a mission.
I feel it's my calling, it's my job to make sure that everyone knows.
Did you think you would ever have to use this advocacy and really put it into play so soon after?
I didn't think I would, but given the chance, I'm just living through my sister. My sister is living through me.
A belief, Teresa says, is so powerful that what happened next would defy all odds.
I felt like I had a headache. I didn't feel my energetic self, but I didn't feel bad. So I managed to shower, get myself dressed, head off to work.
Jen Russell is a third grade teacher at Smith Elementary. Teresa was the school's principal.
When I park and where I enter my school, I have to descend a flight of stairs, and the really bad head pain came back. At that point, I was entering the school and dropped everything.
Describe for me the bad pain.
I felt that my skull was going to crack. Like, I really felt that my brain was too big for my skull. I remember calling the office and saying, I don't think I can stay at work today. I really don't feel well.
That phone call
Yeah.
that sort of precipitated the events that were about to happen.
Yeah.
So I went into my office, as I do every morning, unpacked my bag, and as I'm unpacking my bag, I heard my secretary say, Jen's going home, she doesn't feel well. Something that morning just spoke to me, and I think it's obviously my sister. And I dropped everything that I was doing and said, I've got to go find Jen.
Well, I had exited the school kind of in a side way, like out the side door by the playground, and I had gone to ascend that flight of stairs to head to the parking lot to drive myself home.
So you were seconds away from getting in your car and
Yes.
driving home before
Yeah.
your guardian angel came.
Absolutely.
That morning, for some reason, I decided to go a different way. And when I walked outside, I found her, and she was walking towards her car. And she was pale. She said, it's a migraine like I've never had before. So I said, "You're not driving home."
And in your mind, you're thinking brain aneurysm.
Absolutely.
Teresa was right, and it would be Dr. Mehta and his team once again, this time saving Jen's life.
When Jennifer came to the emergency room, we performed a lumbar puncture, which showed evidence of bleeding in the subarachnoid space, indirectly proving that her aneurysm was ruptured. So the first thing that we need to take care of is that release that pressure, otherwise brain starts suffering.
Given the condition that Jennifer was in, how delicate of a procedure did you have to perform here?
It is a very delicate procedure. We performed what we call flow diversion treatment. So we placed a stent across the aneurysm neck, and what that stent does is diverts the flow away from the aneurysm. And as the stent heals, it essentially forms a new wall of the blood vessel, and the aneurysm goes away.
Just like that.
It would basically start diverting the flow away, and the aneurysm starts shrinking, and the weak point will be reinforced by the metal surface of the stent.
Yeah, it's remarkable.
It is absolute remarkable technology.
Vascular neurosurgeon Dr. Brendan Kalori.
Had Jennifer gone home that day, what could have happened?
We know from other patients that this is a catastrophic diagnosis, probably 30% mortality, 30% of patients have a permanent neurologic morbidity. Some people do well, but that's the exception to the rule.
So Jennifer not only survived, but she recovered completely. That's extraordinary.
Yeah, that was an amazing thing. I went to see Jennifer the next morning, and she was up walking in the ICU and smiling.
That has to be rewarding for you.
Yeah, it's long hours, but it's stories like this that get us up in the morning excited to go to work.
And how do you feel today?
I feel fantastic. I really just feel that this whole experience has been the perfect mix of miracle and science. So I feel blessed that somebody was there and just had intuition. Her sixth sense said, I'm gonna find her. I'm gonna make sure she's okay. And yet also to know it the next step, this amazing scientific procedure saved my life.
It is always a humbling experience, and I feel very privileged that I'm able to do that. I don't take it lightly.
I think divine intervention placed me where I needed to be that day, placed her where she needed to be that day.
You're a lifesaver.
Yeah, I don't consider myself a lifesaver.
Guardian angel?
Perhaps.
One team treating two lives, forever bonded into one miraculous story.
Their prediction was that if I had lived that Tuesday, I would not have lived for a month, that it would have continued to rupture. So it's amazing.